Welcome everybody. So we are into our part 2 of our Pterygopalatine Fossa model, and I'm in VR here, and I'm going to walk you through a little bit of a magic school bus experience through the PT Fossa. So let's get oriented to which way we're looking here and how we're actually going to get to the PT Fossa. So we're looking at an orbit here. We're looking at the left orbit, and if I look down, we can see the left maxillary teeth. Up there, we can see our infraorbital frame in there. And we're on a bit of a glass platform right now. So it's we're sort of just floating in space, and that's meant to just be for orientation for you. So as we move into the orbit here, right before we get too far into it, we see our inferior orbital fissure below here and our superior orbital fissure up here. And inside our inferior orbital fissure, we can see our V2 coming out of foramen rotundum. And we're going to get right up and close there. And walk through this space, particularly the inferior orbital fissure here, to get down into the PT Fossa from the orbit. So to get there, I'm first going to just teleport us up onto this this platform here, where we can now walk around on this platform inside the orbit. So again, here's our V2 nerve running within sort of the inferior orbital fissure here, coming out of foramen rotundum and running along the base of the orbit into the inferior orbital canal to go outside the front of the eye. So I'm just going to move forward here and then turn around. And what you can see is now we're looking outside the orbit. Okay, so we're completely inside this space here. Moving back to here, I'm going to walk us a little bit closer to this inferior orbital fissure here. And as we get closer, we're seeing a couple of different things. We can see the PT Fossa, shown here. And inside the PT Fossa, we can see the PT ganglion. And we can also see outside the skull, here. So this space that we're looking at out here is actually the IT fossa, the infratemporal fossa, and it's bordered laterally by the zygomatic arch here. We can actually see the zygomatic arch just outside, and of course there's the zygomatic process of the temporal bone here articulating with the temporal process of the zygomatic bone, and those together forming the arch. And obviously in the dissection lab, we have to cut these in order to get into the IT fossa, into this space here. Now, the tricky part here is trying to figure out where we are relative to the PT Fossa. So this space here, this sort of V, is the pterygomaxillary fissure. And that's how you get from the IT Fossa in this space over here to the PT Fossa deep in here. But today we're in the orbit. So what we're going to do is actually traverse through this fissure here, this inferior orbital fissure, and we're just going to sort of float and go down to this other glass platform here. Now, as we're coming down here, I want to point out to you that, of course, we've got the PT ganglion connected to our V2 nerve here, but we've also got several nerve branches coming off the medial side of that pterygopalatine ganglion, in addition to two branches that are descending off the bottom of the pterygopalatine ganglion. So as we get into this space, you'll notice that there really is no bony ledge for us to stand on, which is why we've had to make this sort of glass platform here. So this glass platform sort of spans the PT Fossa, but you can see that, of course, it's got some area up higher here, but it's also some area down below here. So this whole sort of conical sort of shape here, that whole space is the Pterygopalatine Fossa. Now, I'm looking at the pterygopalatine ganglion, and I'm on the lateral side of that ganglion. So if I do a 180-degree turn here and look back to where we came from, we can see how we're now deep inside this inferior orbital fissure, and we can see the orbit up here. Now down below, if I'm looking out this space, I'm looking out that pterygomaxillary fissure, which is going to be bordered by the pterygoid bone here, and the maxillary bone here, so pterygomaxillary fissure, to look out into the IT fossa. So pterygoid bone, also known as the sphenoid bone. All right, let's turn back around here and explore a little bit within the PT fossa. So you'll see in textbooks and in this animation, you'll see two sort of fibers descending off our V2 branch to come down to the PT ganglion. This is really a stylistic thing that you see. I'm sure histologically you can see these two branches as well, but in the gross anatomy lab, we typically just see this as one fiber coming down to the ganglion. Descending off the bottom of the ganglion, we have our greater and lesser petrosal nerves, and these nerves go straight down in the PT fossa, and they go between this crack sort of here. And this crack is the crack between our maxillary bone anteriorly and our palatine bone, which is this whole bone right here. And this crack between the maxillary bone and the palatine bone is called the palatine canal, and it's what takes these nerve fibers and brings them down to the undersurface of the hard palate. So the greater palatine nerve is going to provide sensation to the hard palate, whereas the lesser palatine nerve is going to go posteriorly and go to the soft palate. So let's have a little bit more of an exploration in here. Let's walk deeper into the PT fossa and identify some of these nerves coming into the back here. So we've got this nerve here, which is coursing all the way up into this canal up here posteriorly. We've got this nerve, which is kind of going a bit more medial but posterior. And then we've got a couple other nerves that are going through this space here. So let's look back again to see where we've come from. Here we have the PT ganglion, and up in there is our orbit. So we're now medial to our PT ganglion. And I'm just going to crouch down while I crawl through here and have a look more medial at these nerves coming off here. So let's look at these two first. We've got two nerves here which are coming directly medial off the PT ganglion and going through this hole right here. This hole on the medial side of the PT fossa is called the sphenopalatine foramen. Sphenopalatine foramen. It's between the sphenoid bone and the palatine bone, and it's a foramen. So if we kind of walk along this glass platform through the sphenopalatine foramen, we can see these two nerves enter into the nasal cavity. So that's exactly where we are right now. If we look down, we're looking at the palatine bone here, the horizontal process of the palatine bone, the palatine process of the maxillary bone here, and we've got the vomer on the septal wall of the nasal cavity, and we've also got this sort of lateral wall of the nasal cavity. So we're in the left nasal cavity right now. We can even see a few concha here, so these would be concha, part of the ethmoid bone here, but ultimately we're looking out the nose here. So turning back, we can follow how this nerve, this coming off the PT ganglion, is going to be a nasal branch that's supplying the lateral side of the nasal wall. And that's why we call this the posterior, superior, lateral nasal branch. Okay, it's a big mouthful, but posterior, because it's coming from the posterior side of the nasal cavity going forward. It's superior, because it's coming from the top. And it's a lateral nasal branch. And if we kind of look beneath here, we can actually see how there's an inferior lateral nasal branch here too. So this would be the posterior inferior lateral nasal branch. So together, these two nerves supply the lateral nasal wall. Now, where's that inferior one coming from? It's actually a branch off of our palatine, off of our greater palatine nerve right here. So it comes off way deep down in the PT fossa. So what's this other nerve that's coming up beside my side here? So this guy here, that is our nasopalatine nerve. Nasopalatine nerve, you'll notice, goes on the septum. It's not on the lateral wall here. It's on the septal wall of the nasal cavity. So there'd be one on each side. And as I turn posteriorly, we can see how that's coming off of the PT ganglion. So what's this other branch here? We've got this other medial branch coming out and going through this crack here. Where it's going is actually the pharynx. So if you imagine that this is the nasal cavity over here, and the nasal cavity posteriorly would be connected to the nasopharynx. And this guy is going through this crack here, this crack that we call the palatovaginal canal, to enter into the nasopharynx. So this is the branch of V2 that's going to supply the nasopharynx sensation. And sure enough, it's coming off of our PT ganglion because it needs that parasympathetic innervation. So this raises our last and final point here. Where is this parasympathetic innervation coming from? If we look up in the PT fossa, we see our V2, and we know V2 is bringing the general sensation. But where's the parasympathetic fibers coming to synapse within this ganglion? And the answer is that it's coming from greater petrosal nerve, and it's coming by way of this nerve here. This nerve is the nerve of the pterygoid canal. So let me see if I can even get us up into the pterygoid canal here. I don't know if this is going to work. Yeah, look at that. It worked. Okay, so here we are. We've just sort of launched ourselves into the pterygoid canal. And if I turn around, we can see how that pterygoid canal goes all the way down deep into here. If we were to follow this pterygoid canal posteriorly in the direction that I'm looking right now with the laser pointer, this would take us to foramen lacerum. It's in foramen lacerum where the greater petrosal nerve joins with the deep petrosal nerve to form the nerve of the Vidian canal, which we see beside us here. As we walk anteriorly, we see how the nerve of the Vidian canal enters into the PT fossa, and as we look out that Vidian canal, we can see how it's joining in with the PT ganglion. And that PT ganglion is sitting within the PT fossa, just below our maxillary nerve. So I want to point out here that the pterygoid canal is inferior to foramen rotundum and also slightly medial to foramen rotundum. Right? It's closer to the midline. But it's happening sort of before the sphenopalatine foramen, which would be right here. And the palatovaginal canal, which is where our pharyngeal nerve right here is going out to. So it's sort of between the palatovaginal canal and foramen rotundum, if you will. So let's go down back onto our glass platform here. And we will look around. Once I walk out here, we'll look at where we just came from. So I'm on the medial side of the lateral side of the ganglion here, and sure enough, there's our Vidian canal. And on the other side here, we can see our palatovaginal canal and our sphenopalatine foramen, where the nerves going out to the nose are. All right. So that wraps up our second and last session on the anatomy of the Pterygopalatine fossa. Hopefully this was helpful to you and just didn't give you car sickness or nausea. I'm feeling a little woozy after walking around in here, but pretty neat. Pretty neat. All right. So if you've got any questions, let me know as usual. Thanks, guys.